if it works. So far, so good. Hi, everybody. Welcome to the Michigan Parkinson's Foundation virtual education series. My name is Julia Wall. I'm the Director of Education. Having a little bit of IT difficulty again. Anyways, sorry. My screen is messing up. There we go. Okay. Again, welcome. I'm very excited for our talk tonight. I actually saw our speaker last year sometime. I don't remember what month. It was an excellent program, and I know you'll get a lot out of it. Just a reminder, use the hand feature or the chat at the end. Hold your questions until the end and we'll get through the presentation. This will be available on Zoom for you shortly. Within the next couple of days. But I'd like to introduce Amy. I always mess with my last name.
Everybody does. Everybody says Rad. It's technically Rod, but you can call me
Rod. Okay. Amy Rod. Amy Rod, who is a licensed clinical social worker from the University of Michigan. Her area of practice is sexual health counseling, vulvar pain disorders, intimacy challenges, and sex therapy. I know that you received your bachelor's, is that correct, from Michigan? Oh no, your master's from Michigan. Your bachelor's from Colorado, right?
Yes, out in Boulder. Right. It's so beautiful.
Oh, yes, yes. So without further ado, I will let you finish up your introduction and turn it over to you. Welcome, Amy. Thank you.
Thank you so much, Julia. It's so very gracious of you, everything you just said. And it is an absolute pleasure to be here. One of my absolute passions in life is making sure that individuals are empowered in their healthcare, particularly in regard to their sexual health, because I believe it is a topic that everyone experiences, but few have access to appropriate resources. So hopefully tonight you will leave our time together feeling a little bit more confident in the information available to you, and hopefully your curiosity will be spiked, and if you need support, you'll reach out to get those resources. So like Julia was so kind to say, oops, if I can progress my slides, and now they don't want to progress. So let's see. Here we go. Can we do this? Yeah, there we go. So as Julia said, I am a social worker and a certified sex therapist. I'm a clinical supervisor over at Michigan Medicine within the social work department. I provide sexual health counseling at the Center for Vulvar Diseases and then outpatient sex therapy with the Center for Sexual Health. And honestly, a lot of people have no idea what a sex therapist is. And so I'm going to tell you a little bit about that. So sex therapy is a form of traditional talk therapy. There's no touching involved. However, it is specialized to address the psychological and emotional concerns associated with some form of sexual dysfunction, whether that is sexual trauma, which is one of my specialties, pain with sex, desire discrepancies between partners, erectile dysfunction, the wide litany of medical conditions that impact sexual function, or anxiety, the impact of depression on sexual function. The list goes on and on. So if you have any questions about what sex therapy is, then please bring it up at the end and I'd be happy to address those. So what today is going to look like is we are going to first address why sex matters, why we're even here talking about this to begin with, how sexual dysfunction presents in Parkinson's disease, some of the unique nuances unique to Parkinson's disease, and then what to do if you experience sexual dysfunction, what resources are available to you. And then throughout the slides, there will be some additional information on sexual functions sprinkled in there that are applicable to a wide variety of topics. So without further ado, why does sex matter? Well, every single human being is born with the capacity to be sexual. Whether or not you choose to engage with your sexuality is an individual choice. However, every person has that capacity. As a matter of fact, we have research that suggests masturbation actually begins in utero. So before a child is even born, there's evidence to suggest that we engage in masturbation as a form of self-soothing. So this is a part of our humanity that is present in us from the moment we are born to the moment that we die. So regardless of whether or not you decide to be sexually active, your sexual health is going to impact your functioning. So if we look at common cancers, 2 of the 3 most common cancers impact reproductive organs, breast cancer and prostate cancer. So that's going to impact a person's ability to experience or express their sexuality. 4 of the 5 major religions in the world have very specific.
Right there.
Oh. 4 of the 5 major religions in the world have very specific teachings on sexual behaviors. So this is a cultural issue. This is a healthcare issue. This is an individual issue. Everyone's experience. Okay, can you hear me? I don't know if I can be heard right now or
Yes.
not.
Yes, I can
Okay.
hear you.
Okay, thank you so much. So I'm not sure at what point in time I got muted because again, I can't see anything going on the other screen. So I was just saying that, you know, sex is impacted by the culture that we live in, then the community, our neighborhoods, our families, and then our own individual experiences. So this is a very personal experience. It's also part of the greater whole of our society. So sex has lots of benefits, including stress reduction, pain relief, and better sleep. By the way, I love that there's going to be a presenter discussing the benefits of sleep at the symposium. I think that is phenomenal. As a therapist and someone that works in healthcare, I cannot applaud the benefits of good sleep enough. Sleep is so critical, especially to sexual function. And in general, it's just a priority that we need to have. So, all right, sex can increase intimacy and bonding in relationships. Sexual satisfaction can actually increase relationship satisfaction. And on the opposite hand, sexual dissatisfaction can lead to a decrease in overall relationship dissatisfaction. So there are plenty of resources out there available to you to address your sexual health, and we'll get to those towards the end. And again, it does not want me to move forward. There we go. So what is good sex? Well, in case you haven't figured this out yet, porn and Disney lie to us, right? Our media sends us completely unrealistic expectations about what good sex is, what it looks like to have good sex, who has good sex, how it feels to have good sex. So the goals from, you know, somebody whose life is dedicated to the science of sex, the goals of good sex are satisfaction and pleasure. Okay, connection and intimacy are also part of this with partnered sex. And sex is any touch that is given with erotic intent. So when I say sex, I do not just mean penis in vagina sex. That is one way of having sex, and there are so many other endless ways of having sex. Any touch that you give your partner where you are really craving that intimacy and that eroticism qualifies as sex. So, what is not necessary for good sex? Erections are not necessary for good sex. Orgasms are not necessary for good sex. Natural lubrication is not necessary for good sex, and penetration is not necessary. You can have wonderful, amazing, beautiful sex that does not involve any of those things. So we've kind of got to work on shifting our mindset from what we think sex is, what we think good sex is. I hear this all the time. People will think that you have to have simultaneous orgasms only from penetrative sex, and you've got to last for hours and hours, and you've got to be in very specific positions. And really and truly, that's just a myth. Sex is connection. It's authenticity between one person, 2 people. It's a very humbling experience to be in that moment with your partner and to experience that true intimacy. So that is good sex. That is the goal of good sex. Oops. Okay, so how does sexual dysfunction typically present in Parkinson's disease patients? So there's 4 main realms: challenges with desire, physical challenges, emotional challenges, and then relational challenges. And we're going to break those down now. Issues with desire. First, we'll discuss issues with the decrease in desire. So sometimes individuals experience a decrease in desire, and this can be associated with the normal aging process. It is very normal for desire to decrease as we age. A decrease in dopamine associated with Parkinson's. Fatigue, exhaustion, being tired can really make it challenging to cultivate the energy to want to pursue sexual activity. Psychological issues such as depression. Depression has a very large impact on sexual desire. Then we have relationship issues and side effects of medication. Unfortunately, the very reality of the wide variety of medications that are prescribed for Parkinson's disease is that sometimes they do decrease desire. Now, conversely, some individuals experience an increase in desire. What can cause this? Well, again, the normal aging process. Some individuals experience an increase in sexual desire as they age. This could be for a wide variety of reasons, such as decreased external stressors, not fearing that you're going to have an unintended pregnancy. Also, just sometimes the body changes in that way. Sometimes an increase in desire is associated with the side effects of a dopamine agonist, and this can sometimes lead to hypersexuality and compulsive sexual behavior, which we'll get into in a second. Some of the physical issues that are impacted or that impact individuals who have Parkinson's disease include impaired sexual coordination, so moving your body in the way you want it to during moments of intimacy. Again, there's that fatigue, difficulty reaching or experiencing orgasm, and then again, the hypersexuality. Now, unique to male-identified patients include erectile dysfunction and the inability to ejaculate. For female-identified persons, vaginal dryness is also a frequent symptom that is seen. Now, emotional and psychological issues contributing to sexual dysfunction include depression. As I said before, depression has a large impact on sexual desire, and it can make it more challenging to want to be intimate with yourself or with a partner. It can make it more challenging for your body to become physically aroused, whether that is experiencing an erection, having your vagina lubricate naturally. And depression is very common in Parkinson's disease patients, with up to about 40% of individuals with Parkinson's experiencing depression at some point in time throughout their diagnosis. Medications can cause, medications specifically treating depression can actually medications designed for the treatment of depression can actually decrease sexual desire. This is especially true for common medications within the SSRI classification, things such as Zoloft and Lexapro. So now the tricky thing is that sometimes, you have depression, and so that can decrease your desire, but then you take a medication to help the depression, and that can decrease your sexual desire even more. So it's really important to talk with your prescribing provider and make sure you're finding the right medication for you based on the treatment outcomes that you want. Additional emotional and psychological issues which can impact sexual function include anger, stress, anxiety, grief, and mental fatigue. And these are all very natural, normal reactions when you experience Parkinson's disease or are a care partner of someone experiencing Parkinson's disease. Okay, relational issues. We've got changing roles where we're becoming care partners, where one person is providing a majority of care and one person is receiving a majority of the care. And that changes the dynamic within a relationship. Even if you have a beautifully healthy relationship, that's going to change things. And it's important to communicate about those changes. We have an increase in conflict is very common. A decrease or a breakdown in communication. Decreased intimacy, just emotional intimacy, subsequently leading to decreased sexual intimacy. And then decreased touch for a wide variety of reasons. This could be bed sharing, for example. So it's very common for individuals who have Parkinson's disease and who are partnered to sleep in separate beds from their partner due to movements. And while this can be very necessary for healthy sleep, there's the decreased touch and physical closeness of bed sharing. And this can have a surprising impact on a relationship. Also, too, sometimes the touch shifts and the touch goes from intimate, intentional, warm, loving touch meant to cultivate romance and connection to touching based on functionality, right? Let me help you move over here, or I'm going to touch your hand because I need help getting up, rather than savoring that closeness and savoring the sensations of your partner's body. Oh, okay. Now we are going to talk about one of my favorite subjects. So I probably give the little speech I'm about to give you a dozen times a week working in the vulvar disease clinic, because it's a really big misconception that people have about how sexual desire actually works. So when I provide this information, it is meant to normalize your individual experience of your sexual desire and what might be impacting it. So we actually don't have a sex drive. So the term drive is actually a biological mechanism meant to keep an animal alive, to help prevent tissue damage. So thirst and hunger, these are examples of drives. If we don't eat or drink, we are going to experience tissue damage and eventually we're going to die. Nobody has ever died from not having sex. And believe me, I have heard it from many, many people who try and argue with me, but the reality is you don't have to have sex in order to stay alive, in order to stay healthy. Sex is an incentive motivation system in the brain that says, if the context is right, then this could be a really good experience to have. But if the context is wrong, this could actually be a bad or even dangerous or sometimes even deadly experience for us to have. So I love food. I'm just going to own it. I love sugar. So I like to make a comparison to chocolate cake, which is one of my favorite things. So if it is a celebration, let's say it's my birthday and I am with my husband, we've gone out to dinner and we're in a celebration mindset, I might treat myself to a piece of chocolate cake. And that is going to be a source of pleasure and a source of fun. And the context is going to be right. However, if I stop to try and eat a piece of chocolate cake when I am in the middle of one of my therapy sessions, or I'm in the middle of a meeting with my boss, or I am at the gym, the context is going to be wrong. And I may have unintended consequences from that. It might not be as enjoyable. I might be trying to force it. Or if I had a gluten allergy or an allergy to chocolate, and I tried to experience this thing that is pleasurable for some people, I could have a really negative reaction because that might not be safe for my body because the context might not be right. Because my body's reaction to that might not be right, might not be ideal. So the context has to be right in order for sex to be worthy of being desired, to be worthy of being pursued. So we know that the context has to be right. Well, then how do we understand why and how we might desire sexual activity? Well, there's a fancy term for this called the dual control model of sexual response. And essentially, it's like the gas and the brakes of a car. So the sexual accelerator, the gas, is pressed by any reason why we might want to have sex. We want to have an orgasm. We want to be close and connected to our partner. We just watched or read something really spicy. We just saw a very attractive individual. Or, really anything related to sex can press on that accelerator just a little bit. Even if you hate, what you're being exposed to, like let's say someone tells like a really sexually graphic joke and you think it's disgusting, even if it's related to sex at all, your brain is going to press on that accelerator a little bit and say, hey, this is related to sex. Let's get ready a little. So that's the accelerator. All the reasons why we might want to have sex, and really anything related to sex will press that accelerator just a tad. But then we've got the brakes over here. And the brakes are all of the reasons why we might not want to have sex. Maybe that joke that we just heard, we think it's disgusting. That's going to press on those brakes. If we are tired, if we are in pain, if we are stressed out to the max, or we have 8 loads of laundry to do, or you have been yelling at your kids all day long and you still have, to call the doctor to, get that physical set up and call the dentist and make sure everything is all set and squared away. And you just feel like you don't have any energy left. Well, that's all going to slam down on those brakes. And you're not going to have any energy or effort to even think about wanting to have sex. So frequently, when someone presents to me and they're reporting that they have low sexual desire, I say, we want to figure this out. First, we have to figure out what are their accelerators and what are their brakes. More often than not, the problem isn't about wanting to have sex, right? The problem isn't about wanting an orgasm or wanting to, connect with their partner. It's typically they have way too much pressing down on those brakes. Because if you think about it, if you have a car and the brakes are pressed all the way down, even if you slam on that accelerator over and over, the car's not going to go anywhere. The car's not broken for that. It's doing exactly what it's supposed to do, which is staying put. Our sexual desire is much the same way. Those brakes are pressed all down. Doesn't matter how much we want to be with our partner. Doesn't matter how much we want to be sexual. Our brains and our bodies just won't let us go there. So I offer that up to help you better understand what might be going on for you with your relationship to your sexual desire. Okay. And I am, of course, happy to take more questions about that at the end. So let's see if I can progress. Here we go. Now, spontaneous desire versus responsive desire. So when we sit down and we watch a romantic comedy, more often than not, we're going to see spontaneous desire pop up between the characters because it's so romantic and it's entertaining. Spontaneous desire is it's when you look across the room, you see that person and boom, you want to connect sexually with them, or you are instantly aroused, or you want to pursue some type of sexual connection with that individual or with that stimulant. So that's spontaneous. Spontaneous desire is much more common in men than it is in women. For women, the most common form of desire is responsive desire. Responsive desire comes online after you already start to experience a little bit of arousal, a little bit of enticement that helps you pursue sexual activity. So this could be your partner comes over and you're in the middle of doing dishes and they give you a kiss on the cheek and you're like, oh, that's really nice. Okay. Then they give you a kiss on your neck and you're like, oh, that's really nice too. And then they kiss you again in that spot that you just love and boom, you have warmed up and now you are starting to experience that desire and really starting to experience that arousal. And again, that is much more common for women. It's the dominant form of a desire for women. And we don't really see that very often when we turn on the TV and put on Bridgerton or whatever romantic comedy we're watching that day. Okay. Now, a note on increased desire and hypersexuality. It can be normal to experience an increased interest in sexual activity, whether that's related to medications, related to your personality, just changing, evolving. It's a different season of your life. You may experience new sexual fantasies or the desire to experience different sexual behaviors. That's totally normal, right? Maybe for 20 years of your life, you experienced sex in one way. And recently you've been thinking, I'd like to experience sex in a different way. That's totally normal. Okay. The only time where this is really concerning is if it is causing distress or dysfunction in your normal daily life. And if the behaviors are non-consensual. So let's say all of a sudden you create this new fantasy in your brain and it's nothing that's been in your relationship before. And you are just fixated on this. And you bring it up to your partner and they say, no, I'm really not interested in that. And then you continue to push it and you continue to push it. And then they feel obligated to participate in that sexual behavior. That's not okay because that's not really consensual. Or let's say maybe you've never watched erotic imagery or porn or read erotic novels before, but all of a sudden you find yourself really interested in that. Well, that's totally normal. But if all of a sudden you are skipping your laundry to read that romance novel, or you are neglecting to go to your doctor's appointment because you are so distracted with, the porn that you're watching on your phone, well, that's causing distress and dysfunction in your daily life. And so that's something that's a little bit concerning. And we would want to talk to our medical provider about to make sure that it's not a negative side effect of one of our medications or a reaction to some psychological distress and some manifestation of dysfunction that's, expressing itself in that particular way. Okay. And again, I'm more than happy to answer any questions about this moving forward. Okay. Arousal non-concordance. I mean, it's so silly, the terms that we use, but arousal non-concordance is just a fancy way of saying sometimes our brain and body are going to be saying completely different things, and that's totally normal. Like someone can be so mentally aroused and have no vaginal lubrication. They can have no erection at all, but they're mentally like, yes, I am ready to go. That's totally normal. And we go with what the brain says. So you might have a ton of vaginal lubrication, you might have an erection, but if your brain says, you know what, I'm not in the mood, that's normal as well. And we pay attention to what our brain says. Almost every single person has an experience of having some form of physical arousal just out of the blue, whether that is just an erection out of the blue or all of a sudden our body lubricates and we experience other symptoms of physical arousal. And we're just like, huh, okay, that's weird. That's totally normal. Your body having an arousal response does not mean you're interested in sexual activity. Someone else's body having an arousal response does not mean that they want sexual activity, and vice versa. Someone can, again, not be experiencing any forms of sexual arousal and be totally game and want to pursue some type of sexual connection. All right. How are we doing on time? Oh, we're doing great on time. So now let's talk about how to manage sexual dysfunction. So one of the best things you can do is sit back and really reflect on yourself. Reflect on how you are feeling in your body in regard to your sexual health, in regard to your experiences of your sexuality, how this may have changed over time. I really encourage folks, when I first start working with them, we go back to early childhood and we explore the influences of external factors on their sexual development, and we kind of go across the lifespan to really see, well, how did that experience shape your sexual function? How did that trauma that you endured when you were 17 impact your ability to be sexual now? Or how did that experience of transitioning to parenthood impact your sexual relationship with yourself and with your spouse? Because these are all chapters in our life and they lead up to where we're at in our story now. So developing insight is probably going to be one of the most critical steps in improving your sexual function. Understand where you're at and also where you want to be. Ask yourself, what kinds of experiences do you want to have? What experiences make sense for your life? Sometimes individuals want to, have these amazing partnered sexual experiences, but they don't have a partner and don't want to actually pursue having a partner. So we have to work on managing expectations. So what do you think about your body? Do you have a tremendous amount of sexual shame regarding your body, which is unfortunately very, very common because our society attributes a significant amount of shame and embarrassment when it comes to talking about sex. So how do you feel? Like, are you insecure? Are you confident? I did mention that insecurity is the emergency brake when we talk about the gas and the brakes for sexual desire. You can be, pursuing a sexual activity, feeling relatively good about this experience, and all of a sudden you get this moment of insecurity and it's like slamming on those emergency brakes. It just cuts things off and gives an absolute stop. So, all right. So once you understand yourself better, it's really, really important to talk to the person that you're in an intimate relationship with about how you feel and how they might be feeling and what they might be thinking about. A lot of times we make guesses and assumptions about what our partners are thinking, and whether it is a sexual relationship or just a good old-fashioned romantic relationship, that is not a good idea. We should never be mind readers in our relationship, not make assumptions, and check in. communicate. You've chosen this person to be your partner. Least we can do is be honest with them about how we feel and check in and see how they're doing. So when it comes to communicating and cultivating a healthy sexual relationship moving forward, you have to remember that the goal of good sex is really satisfaction, pleasure, connection, intimacy, not penetration, not erections, not all those other things that I said before. And we want to make sure that we're aiming for good enough sex. Maybe at some point in time, you could have qualified for the Sex Olympics, and that's fantastic, but we have to be honest and real. If we are shooting for good enough sex, most of the time, that's good enough. We don't have to have, again, these sexual experiences where we are swinging from chandeliers and it's going all night, and we are, all these images that they sell to us in the media. Like, this is about you and your partner. And that connection just needs to be satisfying, and that is good enough. So another thing to do is to explore different ways of being sexual, letting go of the idea that sex is only, some form of penile vaginal penetration or penetration of some form, and start to explore different options. As I said, there are endless ways of expressing yourself sexually. You can do things like massage, cuddle, read erotica to each other, watch erotic films together, listen to erotic stories. There are so many apps out right now that have erotic stories on them. It's like this skyrocketing app business. It's fantastic. So again, there are limitless ways to be sexual, and it doesn't always have to be sexual too. Non-sexual intimacy is so important and is frequently something that is lost when an individual is part of a care partnership with someone who has Parkinson's disease. So finding ways of cultivating intimacy that are non-sexual too. Connect on shared pleasure and interests that has nothing to do with sex, whether that is finding really good food or going to new restaurants or becoming film enthusiasts, and you sit and have these great intimate conversations about the film you just watched or the board game you just played. It's about that connection, and that's what we need to remember. Okay, if you have concerns, like if you are experiencing unwanted pain or experiencing one of the physical symptoms that I mentioned before, it's important that you feel comfortable talking to a professional about this. All these individuals that I'm going to bring up, we're trained to talk about sex, and it's healthy and fair and valid to bring up sex to your medical provider or a therapist. So medical providers, these are going to be your primary care providers and your specialists. So nurse practitioners, physician's assistants, physicians. You can discuss any physical manifestations you might have of sexual dysfunction, and also talk about the medications that you're on to better assess how they might be impacting your function, whether that is helping or hindering. And then talking to a therapist. So let's say you're noticing, a breakdown in communication with your partner, and that's your primary concern. Maybe sex isn't something that you want to be, want to have be a part of your relationship. So a general couples counselor would be a good fit to have. So this is just going to be, typically 45 minutes to hour-long talk therapy, and it can last several weeks to several months to several years, depending on your preference and what you got going on. So a general therapist can also work with families. So sometimes there are additional family members that might have concerns that need to be addressed in a larger setting. And then a sex therapist. So as I mentioned before, sex therapy is a form of talk therapy. However, sex therapists go through a significant amount of training to address specific sexual health concerns. So you have to have at least your master's to be a sex therapist. And then after that, you do about a year of additional education, and then you do several hundred hours of training, and then I think it's like 60 hours of supervised practice. So it's a long process. Getting my sex therapy certification was harder than getting my master's, to be honest. So, and you want to stick with somebody that is a certified sex therapist. So that terminology is pretty important, because anyone can call them a sex call themselves a sex therapist. It's not a protected term. And sometimes there are people out there who call themselves sex therapists that really don't have the training or the ethics, the ethical standards to appropriately treat sexual dysfunction from a therapeutic lens. So ASEPT is the governing organization for sex therapists, counselors, and educators. And the link to their referral directory is on this page. These slides I'm happy for anyone to have. So Julia, you are welcome to send them out to anybody that requests them. So you can find that information at the bottom of the page. You can also go to Psychology Today and search sex therapist and put that in as one of the topics to list. And a lot of individuals on there are certified. So, okay, so sexual health aids, tools, and some tips. So lubricants are really, really important. If I were to say, like, I want everyone to have one sexual health aid available to them, it would be lubricants. So lubricants help reduce the friction during sexual activity. And unfortunately, excessive friction can be really damaging for individuals who have fragile skin. And it can cause tears, it can cause a lot of pain. Within the vulvar disease clinic, I work with a lot of individuals who have exceptionally fragile skin on their vulva and in their vagina. And you want to make sure you're using a good quality lubricant. So like those individuals who have vulvar diseases and dermatoses are more likely to experience, irritation from water-based lubricants, because a lot of the lubricants that you'll see out there are not the best for your body. A lot of the water-based ones are available at like Walgreens or Walmart in their pharmaceutical aisle. So I really recommend a silicone-based lubricant, and I have a resource on this that I can send to you, Julia, on my recommendations as far as lubricants. So I've done a lot of research into this because there's a lot out there that people need to know about. And so a good quality lubricant is only going to help things along. I want everyone who's experiencing any form of penetrative sexual activity to make sure they're using a good quality lubricant. So again, you could avoid tearing of your tissues, which can lead to infections and pain in general, which nobody needs that. So vibrators are a wonderful tool. They are so common these days. It's crazy. You can go to Target and buy vibrators off the shelf now, or Walmart. It's very cool. There's nothing wrong with using a vibrator or any of the other toys on here. These are all just different tools that are designed to increase one's pleasure. So vibrators can be used by men, women, couples, solo. So again, that's a really helpful tool. And they have vibrators if you're having, for individuals experiencing difficulty with gripping, they have vibrators that can actually like connect to your hand. And so you don't have to worry about that grip strength as long as you feel comfortable having something go over your hand. So lots of toys out there. There are endless types of sexual toys. Every time that I think I've seen everything, someone sends me a link to something else that I'm like, oh, I did not know that could be invented, but look, there we have it. So plenty of toys out there. Now, cock rings are very interesting. The fancy term for this within the hospital is a restrictive device or a restrictive band. And what a cock ring or a restrictive band does is once a man experiences the erection to his satisfaction, whether that is 100% erect or 50% erect or 20% erect, he slides the cock ring or the restriction device over the shaft of the penis towards the base of it. And then you tighten it, or it's already going to be tightened if it's just a ring. And what it's going to do is it's going to trap the blood inside the penis and prevent it from flowing back into the body. And that's going to keep that erection where it's at. It might decrease a little bit as you get it put on. But again, it's going to help keep that engorgement in the shaft of the penis so that you can have whatever sexual experience you want. Now, the tricky thing with those is you can only wear them for about 20 minutes because you don't want to cause some lasting damage from those for wearing them for too long. So then there's also penile pumps. So penile pumps are devices that are used to pull blood into the shaft of the penis. And once that blood is pulled into the shaft of the penis, then a cock ring is put at the base of the penis to hold that blood in there. There are things like wedges, which are, just specially designed pillows to help hold a body at a particular angle. Do not buy the sexual health wedges that are advertised specifically for sex, because you can find much cheaper ones on Amazon that are just listed as like specialty pillow wedges. The ones that are, sold for to be like a specific sexual health sexual health aid will cost you hundreds of dollars, versus like just a regular old wedge pillow will cost you like $40. So then there also are special seats and chairs designed for individuals who have limited mobility, so that can assist with things like thrusting or gross body movements. So, okay. Now, questions. I'm going to
Oh,
look
that
over here, so I apologize for not looking at the screen, and I kept it within time. Okay.
Oh my gosh, that was so good. Thank you.
You're way too
Who
sweet.
knew?
Uh-huh.
Who knew how informative this was? But I just wanted to, before we open up the questions, I will ask Amy if you can um, take your slide down,
Oh, yes.
presentation slide, and will be easier for me to see the chat screen. But I did want to ask a couple of questions. Well, one, a reminder for everybody who wants these slides, they're going to be on our YouTube channel. So you'll have access to this information in its full presentation as well. And then, so can I ask Amy, before anybody jumps in here, of course, I have a list.
Okay.
Um,
Let me just see. Okay. Okay, I can actually see everybody. Yes, my tech worked. Okay. Yes, please. Get me your questions.
so do you do counseling yourself
Yes.
for people? So if they were interested, they could contact you
So
and
unfortunately, the Center for Sexual Health. So let me tell you how big the need there is to
yeah.
normalize this for a second. Right now, the Center for Sexual Health, we've got about 5 therapists. Yeah, 5 right now, and we are closed to new patients. We've got over 50 people on our wait list, and then we have like over 200 referrals that we're still attending
Wow.
to. And so once the wait list gets to be about a year long, we have to close it down. So we are trying to design a new system so that we can get people in more quickly. But we're still working on that right now. So I unfortunately am not able to accept new patients. However, ASECT is a great place to find a sex therapist within Michigan. And again, the training is so extensive to become a sex therapist that any person is going to be familiar enough with, the wide variety of conditions associated with movement disorders and the struggles there. So there'll be some good resources.
Yeah. That's good. I'm glad that I just wanted to have clarity on that. That's always usually a very popular question. And I'm proud to say that one of our social work interns at the foundation is actually going into sexual counseling to be a certified sex therapist. She's working on her master's. So
please turn to her my information. I would be happy to have her come shadow me. I am all
oh my
about
gosh,
meeting people, so please
I
need
will
more.
pass it along. She's fantastic.
Awesome.
And then I just have one more question. And then we'll turn it over. But do I'm always a little confused between the lines blurred with Michigan and like the VA in Ann Arbor. Do you see veterans already in your practice, or is there? I'm just asking for the veterans population. If there's someone at the VA that does this kind of specialty, or is it better off them going to the like Psychology Today or the Asset
Yeah.
site to find one?
My husband is actually a social worker at the VA. So yeah, the VA is does have some wonderful resources. Unfortunately, nothing related to sexual health. I think
Okay.
they've got like a pilot program somewhere in Ohio where they're trying things out. But unfortunately it wouldn't be available to anyone locally or within Michigan because of how licensing works. So not worth it to go to the VA. They did have a sex therapist there, but I don't think she did sex therapy at the VA. So any community provider, or again, yeah, going through ASECT is going to just be the best option. And is it TRICARE? Is TRICARE the insurance for most veterans?
Yeah, that goes through the VA. But I do know I'm married to a veteran. So,
Uh-huh.
well, sometimes. Uh, I married a submariner. That's a special kind of crazy.
Yeah.
Um, but I do know that if there are not services available to someone in a specialty at the VA, they can get a voucher to go outside of the VA system.
Fantastic. Okay.
Yeah. So
So
I just wanted to ask because our veterans, there's a high incident rate of Parkinson's with veterans, and we're working pretty closely now with the veteran community. So that was just for my knowledge. So I'll shut up and I'll turn it over to anybody that has any questions.
and before people ask questions, I just want to reiterate that this is a completely safe place, and I have heard all the questions before. There's no such thing as a bad question. There's no such thing as a stupid question. If there's something you want to know about, it's totally fair and legitimate to ask. So many times people are like, this is a silly question. I'm like, no, that's totally valid. And I'm so glad you asked. So, and again, if you don't feel comfortable asking questions about sexual health or sexual function in a public forum, feel free to shoot me an email.
Yes, and I'm always happy to connect anyone. I mean, you did such a good job. I'm not sure if there's many questions.
You are far too gracious.
Wow. Nobody has any questions? Or any, even if you want to use the chat feature? I'm trying to think of one. I loved what you said about making that like intimate love connection, even if it's not physical, penis vagina. I love that. I cannot begin to tell you how many caregivers I've heard from that it really seems important to them when their loved one just puts their hand on their back or holds their hand. It's
Absolutely.
like really impactful when they mention that, and I think that's wonderful.
Yeah, we need touch as human beings, right? So humans, we're animals, and we're social animals, meaning we desire closeness and connection with other people that are within our group. And one of the best ways of doing that is with, gentle touch. And it's so easy to lose that. It is so easy to lose that when someone's experiencing, challenges with their body, especially when they're experiencing challenges with their emotional state. So here's the wicked thing when it comes to mental health, right? And by the way, sex therapy is rarely about sex, right? So most of the time, it's about the emotions associated with someone's sexual function. Like I said before, I do a lot of trauma work. I also do a lot of grief work, right? You have to be trained in grief to talk about sex therapy, because frequently we've lost something that we had, or we've lost hope for an idea or a want that we had. And so coming back to this, right, with depression, which again occurs in about 40% of all individuals who have Parkinson's disease, right? Depression is a very isolating condition. It makes you want to pull away from the people that you care about, or feel it make you feel like you don't deserve to be cared about. It is this horribly wicked thing. So then we pull away, and our emotional needs go unmet, because that has created this mountain prohibiting us from getting that connection, which we so desperately need. It becomes like this security blanket that starts suffocating us, right? It makes us feel like we just need to stay away, and then it pulls us further and further back, when what we really need is that human connection, is that vulnerability, is that softness. I've had so many people, particularly men, right? Because we don't give men enough options to experience like warmth and connection in our society, right? We say you're allowed to be mad. You're allowed to, well, mad's fine. You're allowed to joke around, right? But you're not allowed to be vulnerable, right? You're not allowed to, crave someone rubbing your head or scratching your back. When in reality, that's what we need a lot of the time. We need that sense of security and closeness.
Hmm. For sure.
Mhm.
So very well said. Um,
You're so kind.
no, I really, this is great. I mean, I could keep you here all night myself. Um, guess what? My chat, oh, there it is. Okay. Someone had said, I love the intensity of intimacy, still pretty mobile, but we are, oh my God, my computer, but we are also open and talk often. I will be tuning, I'm sorry, my computer is like what? I don't know what's going on. I will be turning the YouTube version on for both of us. Oh, yes, the pull away.
Thank you. That's so sweet. I'm so glad to hear that, you enjoy that intensity, right? Because there's so much beauty with that spark and having those moments where you were just so captivated in that connection. Ugh, that's wonderful. And so few other places in life do we experience moments like that, where we're just so connected to our bodies and to our partners. It's very unique. Sex is a very unique, bizarre experience that has so many different facets.
And we spend so much time, like our phones are a distraction, our kids, our grandkids, I got to take medicine every couple of hours. I got to get to rock steady boxing. I got to
Yeah.
get the grocery shopping done.
Yeah.
I mean, we're so busy that sometimes we lose focus of who and what is right in front of us and what's so important and who we think that is so precious.
Mhm. Good sex. So I
We
did.
all need that reminder.
Yeah. Good sex rarely just happens too. So another myth that we have is that sex needs to be spontaneous, and it should be spontaneous. We should just like all of a sudden, want to be intimate with our partners, or that it should just happen. That's not the case for long-term relationships, right? Because our brains change in long-term relationships. We go from that like rush of falling in love and just wanting to be with them constantly to like we're deeply connected with them, but it is there's less of that spice, there's less of that fire, right? And it becomes a connection that's based more on trust and respect and mutual admiration, and a person you want to spend the rest of your life with. But like things get in the way. And so good sex is frequently scheduled.
Yeah.
Couples that have really good long-term meaningful sexual relationships have mutually decided that this is a priority, right? It didn't just happen. They've made the decision. No, we want this to be a part of our lives. And so we're going to work to have this connection and to keep it good, right? It requires a lot of effort and thought, kind of exercise, right? Like
Mhm.
if you want that strength, you got to practice and make a plan for it. And so I do recommend scheduling sex, or sexual intimacy, like, maybe once a month we have a night where we just lay down naked together, or we watch a film, or one of the exercises I give my patients is to just talk about it, because sometimes there's a lot of anxiety or awkwardness about this mutually shared experience that everybody in the human race has some capacity to experience. So yeah, schedule it. That's piece of advice.
That's great. Well, I want to be very respectful of your time, and we're at 8:05. I don't know if anybody has any last minute questions, or if you want, you can certainly feel free to email me. I can connect. whatever way we can. Again, this will be recorded and up on YouTube by Monday. Amy, I can't thank you enough. It's a great. It was, I think, even better the second time around.
Oh, you're so kind, Julia. Well, please let me know if you need anything moving forward, and I will get those resources to you. Of
Thank you so much.
course.
Thanks,
All right.
everybody.
Thank you, everyone, for having me.